Virtual Reality and its Different Roles in Healthcare by Arianna Bennici. Virtual reality allows for people to utilize technology and have an easy access to interact with the world. Within the past couple of decades, scientists have really adapted to this new concept of learning and have been implementing this new profound knowledge into all areas of life. But most importantly, virtual reality is being used in healthcare centers to help provide for those in need of assistance. Practices in healthcare use VR to train, improve patient safety, and enhance skill development through the use of sounds and real life graphics. The user can properly interact with a given situation, whether it be surgeries or skill training. It is adapted to different learning and allows for one to experience what it takes to be a healthcare professional by encountering patient scenarios which they are likely to experience while working within the field. It is a lot easier to learn from one's mistakes and gather information at a much quicker rate. For example, nursing students often use haptic simulators because it allows for them to utilize their sense of touch through the use of virtual images and movement on a computer screen. Healthcare communities have an easier experience creating different diagnoses and forms of treatment by providing care for virtual characters with chronic pain, balance issues, depression, etc. This technical treatment tool is used in different health clinics because of its added value capabilities. There has been an improvement in rehabilitation patients, reducing stress and anxiety, and during medical procedures, virtual reality helps serve as a distraction. This hands-on-hand training allows for effective and successful practices. Workers can develop clear treatment goals, and patients can become more comfortable with the technology. Healthcare workers are often overlooked throughout the developmental process of virtual reality, which makes it harder for the application of this device to be implemented in healthcare routines. This technical treatment tool provided has minimal degree features and experience control capabilities, making it non-practical. The general concerns for this technology is that it promotes less face-to-face communication, cybersickness, lack of educational training, cost challenges, and acceptance of the technology. More specific problems include safety concerns, virtual reality side effects, and the validation for application. Without consideration, a user can fail to make a strategic decision when having to complete a task in the real world. Many countries even believe that virtual reality lacks clear standards, has limited infrastructure, problems creating content, and has insufficient support from management. The implementation of virtual reality in healthcare is yet to be perfected. Technical companies are working very hard with healthcare providers to help eliminate the potential harm that the device can cause. As of today, there are many efficient working medical tools that work with virtual reality, which benefit society. This technology has a primary goal of transforming healthcare so that new diagnoses, treatment, pain medication, and surgeries can be developed more effectively. A specific device which is being developed is sensory gloves. This device allows for the user to record fine motor skills and analyze tactical feedback. It is used to mimic surgeries and being altered to allow for fluids to change the thickness of certain materials so the glove can be adjusted depending on what is touched. New software has been developed to help educate surgeons with virtual images of their patients' MRI and CT scans to create a virtual model. Patients get a virtual experience of what their surgery will go about. This process helps train and assist surgeons on how to go about the operation while also providing inside knowledge to the patient. Surgeons can plan into surgery, which makes it easier and more accurate, while the patient can further educated on their own anatomy. For those with a phobia, virtual reality allows for these patients to slowly be exposed to their fears in a gentle process to effectively eliminate anxiety. Those who have stress explain that virtual images and auditory elements allow them to feel more calm and relaxed. Individuals with an impairment will go to receive cognitive virtual reality therapy to help their attention and functioning skills. Virtual reality is also used to treat those with PTSD, where they gradually experience less fear by interacting with different smells, vibrations, and 3D audios. Scientists are working very hard to improve the technology for surgical training, helping patients with dealing with chronic pain, and mental health support. For the future, companies are focused upon finding ways to help senior citizens use these technologies to improve their memory, rehab therapy, socialization, and functioning abilities. There has been a 35% compound annual growth rate towards healthcare centers' uses of virtual reality. By 2026, virtual reality in healthcare will be around $40 billion. Although there are many challenges with virtual reality in healthcare, this technology is continuing to be enhanced so it will not just provide help for a patient's safety, but it will also accommodate treatment plans, therapy delivery, diagnosis accuracy, and so much more. Thank you so much for watching.